everyone, and welcome to Dede Talks, the Art of Specialty Lenses. We have a very special guest today, Dr. Lindsay Sicks. Lindsay, how are you? And welcome to the show. Tell us a little bit about yourself.
Hi, Dede. Thanks for having me. It's great to be here. Nice to see you virtually. We just saw each other recently, so it's nice to be back together again. I'm Lindsay Sicks. I teach at the Illinois College of Optometry. I fit specialty lenses. I always say that's my first love. And my second love is I'm teaching advanced surgical procedures. So I teach lasers, advanced procedures, minor surgical procedures, and injections. So a little bit of everything. That's what I do in my professional life. And then I also work in an outside practice, and I live in the suburbs with my husband and my kids.
Fantastic. So Lindsay, as an educator, what importance do you put on RGP lenses for specialty lens patients?
Yeah, I mean, great question, right? You have some people out there saying fitting GP lenses is a dying art and nobody needs them. And I can tell you, I have patients every day that come into my office and need them in order to see. And I think it's a good explanation to people out there who don't understand what we do, that these are patients that can't see out of glasses. They need contact lenses in order to be able to see. And in order to function and live their daily life, do their work, and do the things that they need to do, things that we probably take for granted. So the art is out there. It's the patients are out there. You just have to be willing to let people know that that's what you want to do, and that's one of your passions. I'm fortunate that I work in a practice where those patients kind of just come to me. But I know there are students that I teach that want to build that part of their practice. And so I think once you start fitting lenses and getting comfortable with that, the patients will refer each other, chat with each other, and they'll come your way.
It's funny because they travel in packs. Like they come in packs of 3, 6, or 9 all at the same time.
Yep.
And you're absolutely right. They really are our canvas to work with. And I think that's really important whenever we start working with these patients, because I've had history in the clinics as well. And it's just the most amazing thing that you can do. So you've been doing this for several years. What's the most influential piece of advice that you've received when you started to break into the specialty lens business?
I think when I was a young fitter and a young faculty member, the best piece of advice that I got was to just kind of say yes to everything. And I think that goes for not only your professional life, doing the things that you want to do, but also with fitting. You have to kind of take some risks. And there are probably some fits that I undertook when I was younger that I probably would do differently today or approach differently, but you don't learn about the art and science of fitting lenses until you make those mistakes. And I think you're a testament to that too. I mean, I email you all the time. I need help with this fit. I don't really know what to do. Right. And so it's getting that feedback in what's going right for your patient, what's going right with the fit, what's going right with the physiology, and what might be going wrong, and how you can approach fixing that. And part of it's also listening to that patient, because
absolutely,
if they're happy, you don't have to go making your fit look perfect. And I guess that kind of dovetails with the second best piece of advice, which is we're not in the business of making pretty pictures or pretty fluorescein patterns. That's, sometimes we say like it's ugly, but it works. And I will say too, both of those pieces of advice came from Jan Jerkis, who was a longtime faculty member at ICO. And I miss her all the time. She's just a very wise individual. And she taught me a lot of what I know. So.
Oh, I remember telling a patient one time, don't tell anybody who fit this lens because it's the ugliest thing I've ever done, but it works. And just don't tell anybody where you got it. So what do you feel are some of the key points for practitioners who really want to break into the specialty lens industry?
Yeah, I mean, get to know your labs, get to know your lenses. You don't have to have every single lens. I think I work with students and I work at the college, and we have access to pretty much every lens and every fitting set that you could imagine. We have a whole room full of them.
Right.
But you don't need that in your practice. You just need a select set of lenses to meet the needs of most of your patients. And if you find you need something that you don't have, you can either work with your lab channels to get what you need, or they can lend you a fitting set. So I would say just, use the tools in your toolbox, talk to your lab consultants, learn all that you can from every case, and kind of take that knowledge and apply it to the next patient that you see. And don't be afraid to take risks and try to fit patients.
Well, and how many times have you seen something you've never seen before, but you see 3 of them in the same week?
Yeah.
And it's like, I just had this, or you'll see that happens. And we see that in the consultation realm quite a bit, is we'll not hear about anything for weeks or months. And all of a sudden you've got 3 or 4 cases of the same thing that come in. And we laugh about them traveling in packs, like I said before.
Then you're just copying and pasting your emails.
Yeah, I just saw that. Yeah, I think I can do this again. Well, and I do think utilizing your labs as well and your lab consultants, because they do hear about this, sometimes even more often than the practitioners do. So they've got some experience, and especially new fitters can really lean on that experience and lean on colleagues as well.
Yeah, yeah.
So what are your top tips for getting students ready to break out into the real world of specialty lenses? Because it is different. In specialty lenses is very different than in standard practice.
Yeah. For students, I think it's a lot of, they have to be willing to get their feet wet. And the information that they gather is going to really affect the lens fit that they get out of it. So we like to say like garbage in, garbage out, right? So
exactly.
When you're transmitting information to the lab, you don't necessarily have to know how to make the change in the lens that's going to solve the problem, but you have to be able to tell the consultant and tell the lab what's happening, what you're seeing. And that includes gathering all the correct information and then like transmitting it correctly. And one of the most common issues that I notice is, over reliance on your OCT when you're fitting a scleral lens. I think, the scope study has showed us that it's really important for us to look in the slit lamp. And so I teach my students, you really need to look at the slit lamp, look across this keratoconic eye, see where the minimum amount of clearance is. And you need an OCT scan through that, because otherwise you might be making adjustments that you're not prepared to make, or you'll end up with a lens that's crashing down on the cornea. So, your end up product is only as good as the information that you collect. And sometimes you'll send information in and they'll ask you questions back, right? You've asked me questions back before. Oh, yeah. Well, what's the HVID? Where's the lid sitting, right? What's the pupil size? Because you don't necessarily always think of that or know that it's something that's helpful. So the more information you can gather on the front end and then transmit that information accurately and completely to the lab helps everybody kind of work on the same team.
Well, and I know we utilize photography quite a bit, like photography of fluorescein patterns and such as that, because especially with some of the newer practitioners or students that are really learning, they can't always articulate what they're seeing in the fluorescein pattern. And then we can take those pictures and articulate it back. And I think sometimes that really helps to understand or speak the same language. That's one of the things I try to tell the students that I work with, and also with newer practitioners. We want to be on the same page. And if we're speaking the same language, then we're going to have much better results. So it is really important to communicate with your consultants. So, all right, fantastic. Now for artistic talent, speaking of artistic talent, everybody that we talk to, nearly all of the optometrists that I know have hidden talents that they will share with me and share with our viewers, which I think is fabulous. Now you have something that we've never done before, and you are a cake decorator. So tell us a little bit about some of the cakes that you've done, because they're absolutely spectacular.
Yeah, I'm not very artistic, but I can make tasty things. So when my niece was born, she was the first baby of our family. And so when it came time for her to have her first birthday cake where she knew what was going on, she was 4. And so that was when Frozen first came out. So I made her this totally elaborate, over the top Frozen birthday cake. And from then on, I've kind of been the birthday cake maker. So I've made my nephew a tractor cake. I've made my daughter a unicorn rainbow cake and a lamb cake. And I've made my friend a birthday cake with beer bottle candles. So it's just kind of whatever somebody wants for a birthday celebration. I'm happy to oblige and try to use my piping bags and make something that's cute.
Well, the fact that you can make a piping bag work impresses me. So I come out with globs, and because I've tried it, it doesn't look good. So did you get any like baking training, or are you just kind of self-taught? Or
no, I always wanted to take Wilton cake decorating classes, and I never really had the time because I mean, someday I will. And I'll actually be like I don't know, what do you call it? Semi-pro, amateur. I'll still be an amateur probably, but at least I'll be trained. No, a lot of practice, eating a lot of my own creations, feeding my family. My friends in optometry school used to laugh because I'd make muffins and cupcakes all the time, and just feed my whole row of friends. So it's just something I do to keep myself busy, blow off steam, be creative in the kitchen when I'm not doing optometry.
And it's funny, those of us that are in the business do use it to blow off steam.
Yeah.
It's interesting how we take those pieces of art that we create every day in clinic and turn it into something else, and use that artistic outlet. So Lindsay, thank you so much for being here. I always enjoy talking to you and spending time with you. And we've just enjoyed each other since, I think I met you the first time when you were a resident, if I'm not mistaken.
Yeah.
Quite a few years back. So I know that we've known each other for a few years. So thank you so much for being here with us. And we appreciate you so very much for being here.
Thanks for having me. It was super fun.
Thanks. And I'd like to thank ABB Optical Group for their support for Dede Talks, the Art of Specialty Lenses. Stay tuned for future episodes as we move forward in this adventure.